So thank you very much for the introductions, and I'm very happy to be here today to talk to you about a very important problem, the problem of population aging in China. Now, this is just a figure from the UN of population projections, the percentage of the population in China that's going to be above 60, above 65, and above 80. And you can see we're at a point here where there's really an inflection point. We're seeing a much more rapid increase in the coming years than in the past in the percentage who are old. Those above 60 are already about 15%, 13%, and by 2050 it'll be well over a third of the Chinese population. And of course, given China's retirement system, many people above 60 typically aren't working. So that puts enormous pressure, obviously, on the whole economy in terms of generating enough output to not only increase standards of living, but to support this large elderly population. So if we think about what are the major policy challenges associated with population aging, and this is not, of course, just for China, but for Hong Kong and for many countries in the world. The main policy areas that are specifically directed towards the elderly are pension system reforms and medical care and long-term care systems. These are the two most critical policy areas for older people. And of course, in thinking about pension system design, it's not easy. You want to ensure the financial security of people in their older age, and you want to have broad coverage of the population. At the same time, given these economic pressures, you really do want to encourage more people to work at older ages. As long as they are still healthy and productive, we should certainly not create incentives for them to stop working if they want to continue working. And we also want to be very careful that if we create public programs that support the elderly, that it doesn't lead to a crowding out of private support. In other words, if families think that the government is going to take care of all the problems of their parents, then they may feel that we don't have to worry about them and we won't save as much and we will just rely on the government to take care. And if that happens, obviously, we're just shifting the burden of support from the private to the public sector and not necessarily improving the nature of that support. And you can see right away that there's a tension between providing security in order. If I give everybody a pension, I immediately have this issue about how can I encourage them to work when they have a pension, because that's an obvious disincentive. And also, if I'm giving everybody money or support, how can I avoid crowding? So there's an inherent tension in realizing these multiple objectives. Now, for healthcare systems, we know many countries struggle with creating an effective healthcare system. It's a huge political issue, how to reform healthcare in the US and in almost every country. And the goals are similar. The first goal is that we want to provide universal coverage, reach as many people as possible, prevent excessive levels of vulnerability in the population, and we need to design a system that not only covers people, but provides an adequate level of support and quality of support so that we can not only give people some access to insurance, but actually improve their health, make it something that they can really use to improve the quality of their lives. And that creates many challenges about how to design the systems to create the right incentives, both for individuals and for healthcare providers, and how to create a financing system that can sustain the achievement of these goals. And the healthcare system also needs to think about improving the quality of care and preventative services for chronic diseases, which are really a different set of health issues than the issues that many developing countries deal with initially during their rapid growth period. So these are all challenges for China. And to try to provide kind of evidence-based policy advice on how to confront these challenges, I've been part of an initiative in China to establish what we call CHARLS, which is the China Health and Retirement Longitudinal Study. And this is a major survey effort in China. It's a commitment not just to do a one-time survey, but to continuing following the elderly indefinitely into the future. The main model for the survey is to do a survey every 2 years of a representative survey sample of residents of China aged 45 and older. And we start a little bit before retirement age because we want to understand the processes that lead into retirement. This survey, we released a major report based on the first national baseline survey, which was conducted in 2010 and 11, 2011, and it was released, 11-12, and it was released in 2013. And one of the main, I think, values of this effort was just documenting facts about what the status of the elderly was in many respects. Now, China has different surveys that are done. Many of those surveys do not focus particularly on the elderly. Many of them are not publicly available, so the researchers can do systematic research or study of problems focused on the elderly. And many surveys, because they don't focus on the elderly, don't have enough of a sample size of the older population to really do very sophisticated research. And this effort was intended to address all of those limitations and create a data infrastructure that could provide a continuous set of research results that could inform policymaking. And this initial report, one of the main findings that drew a lot of attention was just the poverty rate of the elderly, right? So we found that if you look at the consumption levels of elderly people in China, that for those aged 60 and above, the poverty rate was about 23%. Quite substantial, and significantly higher than the younger group in our survey, those aged 45 to 59, where the poverty rate was 15%. And if you did it, the calculation based on income, the poverty was even higher, nearly 29%. And this received a lot of attention in the media. The Wall Street Journal had a front page article in the international edition, in the US edition, on the plight of the elderly in China. South China Morning Post, CNN, Science magazine. This is the article from Science, which had this picture of older people and cited this result on poverty, that nearly a quarter of China's elderly in poverty. Now, this survey, the China Health and Retirement Study, is part of a family of similar surveys that have been conducted in countries around the world. So we're in some ways not inventing the model. We're extending it to China and adapting it appropriately. The first survey was actually done in the US, and this is a health and retirement study which is housed at the University of Michigan. So I actually know a lot of the people from my past appointment at Michigan who were involved in the original health and retirement study, and that's been ongoing since the early 90s, so now is in its third decade or so, and has been one of the most influential social science data sets in terms of being the source of academic publications, and also gets a lot of support from the US government because it has so much policy relevance to understanding issues facing the elderly in the US. And after the US started this program, in the 2000s, another survey started in the UK, and then later a kind of a joint survey of 15 to 20 European countries started soon after. And then it went kind of global. And in Asia, we're now part of a family of studies. There was an old survey in Indonesia which wasn't elderly focused but has been adapted to become more elderly focused. And then a similar survey started in South Korea in 2006, in Japan in 2007, China since 2010. This is our survey. India is doing a survey later this year, and Singapore, there's a similar study being planned. And notably, there's no survey yet in Hong Kong. And I think there's enormous scientific value to perhaps think about starting such a survey. All of these surveys share a couple of common features. The first is that they follow people over time. It's not a one-time survey done, at different years. It's really, we find a sample, and then as they grow, we follow them and see what happens to them. So it's a dynamic study of changes, and this allows for much better causal kinds of interpretations of what's happening compared to cross-sectional studies. And the other thing that's unique is these are all highly multidisciplinary studies. Although I'm an economist, all of the teams working on these studies, including the China one, have medical doctors, they have people in sociology and other fields. And so it captures not only the economic well-being of the elderly, but we actually conduct physical health exams of each of the respondents. I think there's a picture here of a medical exam being done of an elderly person for the CHARLS study. And we also ask about questions about family relationships, family support, psychological well-being, depression, cognitive function, in addition to, of course, spending a lot of time understanding the impacts of policies. What is your retirement decision based on? What kind of pension program are you involved in? Your health insurance coverage, et cetera. And having all of this data from different domains really enriches the kind of research insights that can be produced. And so what I want to do in my remaining time today is present some more of the facts that we learned from the National Baseline Survey. The second wave of the survey has also been made publicly available just earlier this year. And then focus a little bit more attention on the results of a couple of academic research papers that were written using the CHARLS data to give you a flavor of the power of this type of social science research. And then I'll conclude with a few comments about the policy challenges that China is facing at the end. Okay. So the CHARLS study, we started with a pilot survey in 2008 in 2 provinces. One of the richest provinces in China, Zhejiang, and one of the poorest provinces in China, Gansu province in the northwest. And then that was really to make sure the model worked and to test out all of the procedures. And also we got quite a lot of interesting research out of that pilot studies because it was a decent sample size of nearly 3,000 respondents. Then the national baseline was done in 2011-12. I'll talk a little bit more about that in a second. And then in the next year, we also followed up the pilot sample. We followed them kind of to test the tracking ability to make this a longitudinal study. And then we implemented the second wave of the national survey in 2013. And we'll be going back this year for the third wave and forever, as long as we can keep finding funding to support the research. Okay. So the national baseline had a sampling strategy which I was in charge of, where we sampled at multi-stages 150 county level units, either urban districts or rural counties, and then 450 villages or neighborhoods in urban areas. And then we constructed maps of the communities that were picked and mapped each dwelling in the community using Google Earth and other mapping softwares. And then we took a random sample of those dwellings, and if the household had anybody aged over 45, then they became eligible to be sampled for our survey. And the result was a sample of over 10,000 people throughout China, and about 18,000 persons. What we did is we would randomly, if there was more than one person, 45 or more, we would randomly pick one. And then if they were married, we would also interview the spouse, okay? And the spouse regardless of their age, even if they're younger than 45. So it's a representative sample of those aged 45 and older, plus spouses of these people. And this is just a plot of where our survey counties are located, so all around the country. One also important feature of the CHARLS data is that it's publicly available, right? And which is different than most government-run survey data sets in China, where there's still not a culture of data openness. And what you can see here is that since we made this data public, the number of registered users has just increased. It's really skyrocketed. So it's, as of, this is just almost a year ago, we had over 6,000 registered users of the data. Many of them in China, many of them in other countries. So I think any place where there's a graduate student interested in working on China, they look at the CHARLS data set. Okay, so, and this is why these types of data sets are so powerful. They can be used for hundreds of dissertations and academic research papers, and research on many topics that weren't even anticipated when the survey was originally designed, because it has a base kind of multi-dimensional types of indicators. All right, so let's get to some more results. So one thing we asked about is the relationship between older people and their children. And we found that the percent that were receiving transfers from non-co-resident children was about 47%. So most people are actually not getting transfers in the past year from their children. They're not getting money from their children. These are among those aged 60 and above. And of course, some of them are living with their children, so they're obviously don't need to get transfers from their children. The children are covering a lot of living costs. But even if you look at the percent who are not living with children, the percent receiving transfers is still only a bit higher, 53%. Okay. Now, I don't want to overstate this idea that many elderly are not getting enough support from their children, but there is kind of I think a flawed, perhaps, myth about Asian families, at least prevalent in the West, that in Asia the families will always take care of their own and everything will be fine, even without the government support. And that's certainly not the case in China. There are many vulnerable elderly. Now, we've done other research that's shown that for poor elderly, they tend to get a lot more support from their children than richer elderly, which would make sense. So again, this number should not be interpreted as saying, half of the elderly aren't getting they're suffering because they're not getting support from their children. And the amount of support, the median positive net transfers received by those who do get transfers from their children is about 1,700 renminbi in the last year. So, excuse me? No, this is total for the whole year. Yeah, so it's not a lot of money either. That's what I'm saying, right? On average. A lot of people come and give something at Spring Festival, but it may not be a lot of money. So there's definitely a need for the government to think about the fact that there's a lot of vulnerable people out there. China, of course, has been aggressive. If you watch the Spring Festival TV show in China, there's always a bunch of commercials about, you have to go see your parents and and go visit them at Spring Festival, and there's of course laws in China which have said it's illegal not to support your elderly. So children, I've been interviewed about this. Children who've been sued by their parents for not visiting them or providing support. There is actually a legal provision saying that children must support their parents, although it's of course hard to interpret that. So anyhow, we've been trying to understand the nature of these vulnerabilities of elderly people. One major area of difficulty for older people in China today is their physical health. Right? So we have lots of indicators showing that 38% of the elderly have some kind of physical limitation to complete daily activities. This is a very high rate compared to richer countries, which would be typically 10% or less, right? And those who say they need help to complete the activities, they can't do it on their own. There's about 24%. 33% say they experience some sort of bodily pain, and then 54% are diagnosed. If you measure their blood pressure, are at risk of hypertension. And obesity is starting to become a problem, or being overweight and obese. And if you just ask them about their general health status, 32% will say they have poor health, which is, again, a very high rate of health, of poor physical health status. Now, another issue is whether they're even aware of all of their problems. So one thing we were able to do, because we took the blood pressure measurements, we could come up with people at risk of hypertension, and then we asked them, do you have hypertension, or have you ever been diagnosed with hypertension? And what we found is a very high rate of people who have hypertension who have not been diagnosed. And even the ones who are diagnosed, the percentage taking medication, there's still a group that's really not dealing with the problem appropriately. Okay, so these are reflecting limitations in the screening capacity, the preventive healthcare services of the healthcare system in China. If you look at some policy variables, if you look at health insurance coverage, one thing China has done a very good job of is expanding health insurance coverage to virtually the entire population. At the time of the baseline survey, already 95% of rural people now had health insurance because they had expanded a new rural medical insurance program. And in urban areas, it was near 90%. And these numbers are definitely higher now than they were then, because this was still at the rollout stage of some new programs designed to get everybody covered under health insurance. The problem, though, is that China has a bunch of different health insurance programs. It's not everyone getting enrolled into one kind of comprehensive program. Everyone has a different program in China. You know, people who are getting insurance coverage from their employers, government officials, state-owned enterprises, they're under the old system. They've always gotten coverage. These new programs that cover rural people and some dependent people in urban areas do not require employers to do anything. They're direct benefits that go directly from the government to people who meet these age requirements and in some cases contribution requirements. And so we have at least 6 different schemes that we identified, different health insurance programs, and you can see the population coverage of these different ones. The biggest by far is this new rural health insurance program. And then the premiums vary, but more importantly than the premiums, because the premiums still are not very high for any of the programs, is that the quality of the coverage and the benefits you can get are very, very different. A lot of the newer programs have gotten scaled up to full coverage, but the benefits are still very limited. So it's not clear that they're going to help families deal with major medical conditions. Okay, so huge disparity in the quality of the insurance programs. Now, if we go to kind of the non-physical aspects of health, we also find big problems. If you look at the percentage of the elderly who show elevated depressive symptoms, then it's about 40%. Okay, and especially high for women. Nearly half of women above 60 have elevated depressive symptoms. China's elderly have one of the highest elderly suicide rates in the world. The highest is in Korea. Japan also had a very big problem of high elderly suicide rates in the 80s and 90s, but has improved quite a lot in the last decade or so. So this is a major issue. And in fact, one project that I'm involved in is a project where we're taking this data on depression from China and actually working with researchers from Japan and Korea with similar data to try to understand what are the factors in the different countries that are contributing to higher rates of depression. And are there similarities and are there differences, and what can the different countries learn from the experiences of the others? Another important area is cognition, right? And this is a paper, actually not from the CHARLS data, but from an academic paper that ran a similar test of memory. We do this in the CHARLS data too. There's a simple survey method to get people's cognitive function. You just read a list of like 10 words, and then like a minute later you say, how many of those 10 words do you remember? And you just count how many you remember. And then maybe 5 or 10 minutes later you say again, oh, remember those 10 words? How many do you still remember? And that's it. And from that you get an indicator that is quite robust to indicating cognitive function. And using that type of measure, you can find there's big cross-country differences in the average cognitive function of older people. Excuse me?
I forgot the question.
What words? Right. And so you can see the line for China is here. So it's this violet line. And so China is on the low end. But of course, you have to remember, China's elderly today in China really grew up in very adverse circumstances, right? Very poor, very, lack of many basic kind of support institutions. They lived through these traumatic historical episodes. And so what we're going to see, we paint a fairly bleak picture of today's elderly in China, which I think is really important for policymakers to know. But the next group of elderly in China are going to be much better, because they're going to be and increasingly so. They're going to be much more educated. Most of our sample didn't even finish primary school. I mean, most of them are illiterate, I think, of this age group in China, right? So it will improve with the newer elderly. But of course, we still need to deal and take care of the current elderly. But you can see what's really interesting to me is that if you look at the average cognitive function of someone in China who's, let's say, age 65, and then you say, oh, how, you know, if you look at the US line, you take the same cognitive function score, that's the same as a person who's, you know, over 80 years old in the US. The average cognitive function is similar to the average function of 65-year-old China. And if you compare that to India, India is the lowest here. You know, that's going to take you, it's like a 55-year-old in India is similar to a 65-year-old in China, is similar to an 80-plus-year-old person. So there are very big differences in the average cognitive function. Of course, this has a lot of implications for can people be expected to work longer, and it has implications for issues of Alzheimer's and why the research being done by my colleagues in life sciences on Alzheimer's disease, and they're now getting involved in a major way in trying to understand these problems in China and collect data in China, I think is so important because this is a group that's at much higher risk of these types of cognitive function declines than I think other countries. Okay, so the other thing that we can look at is, and economists kind of are interested in, is understanding the differences in people getting pensions. Okay, so this is from a World Bank report on aging that's forthcoming. We held a major conference on population, our institute did, with the World Bank last spring, where some of the results from their reports were discussed along with some research being done by people from all over Asia. And you can see for China that there's really two worlds in China. If you look at urban China, most people are covered with pension, and it's very good pension coverage, right? If you look at rural China, this was at the time of the baseline, then you know there's very low coverage. And what you also see, I don't have the figure here, is that in China, if you look at urban people, they're all retiring early. You know, many retiring in their 50s. Almost no one's working in their 60s. If you look at rural China, there's no pension until very recently. They've just scaled up a new rural pension program, but again, very limited benefits. And everybody works until they drop. I mean, they just work until they physically can't work, and so you see, you know, people working until very old ages in rural China. So it's like, you know, urban China is like the West, and rural China is like the poor countries in the world. It's quite dramatic in China. So a couple of research findings I wanted to share with you that try to kind of analyze these numbers in a bit more depth. One is the effect of this new rural pension program on various outcomes. So the rural health insurance program, the rural pension program, sorry, at the time of our baseline survey had been scaled up to about half of the villages in China. Now it's 100%. So if you go to any village in China, people over 60 years old will be getting a check every month. It's not a big check. It's like 65 RMB a month. You know, in a year it's 600. What is that? 700, 800 RMB a month. $100 a year. Sorry. I mean, so it's very limited, but everybody's getting it once they hit age 60. And we had some members of our research team from the World Bank and Peking University. And I should say the survey is really run out of Peking University. And the main PI is at Peking University, and another PI is over at the University of Southern California in the US. We did some research on the impact of this program. And remember, what we care about are these different goals of pension program. We care about, is this actually helping people avoid poverty, this money? Is it being useful? But also we're worried, it doesn't mean they stop working. Is it creating a work disincentive? If they get this money, do they kind of retire early or don't work till they drop? And are there other impacts? And so we use the data in CHARLS to look at this. And the basic strategy of the analysis is to use what we call kind of a discontinuity design. What does that mean? It means that if you go to rural areas, in the data, this is the data, the CHARLS data speaking here to you, that the percentage of people who are getting this pension is very low if you're below age 60 or even a little bit beyond 60, right? But once you get over this age, then you're eligible and you start picking up these benefits. So the idea of this research design is to compare kind of these people who just, it's basically to compare 60, 61-year-olds to 59-year-olds, right? Because the 59-year-olds don't have it because they just haven't reached it. And the 60-year-olds, have the benefit, and they're pretty similar in health and other things, right? Because they're just 1 year difference at this older ages. And that design, you can kind of get at a better sense about whether this pension is having a big effect just at that threshold when you get eligible, right? And what they found was that it significantly reduced poverty. So it was reaching one of those goals, but it was also reducing the labor supply, meaning that people were more likely to stop working once they got the pension than for people who didn't have the pension. And of course, at this time, half of the village didn't have the pension, so we can always look at the comparison in villages with the pension and without the pension. And we're also worried whether, when you get this money, are children going to supply less because the government is supplying more? And there is a little bit of evidence of that, that the percent getting private transfers is falling a bit once you get the public pension program. And this doesn't mean, these worrisome effects that it reduces labor supply and it reduces private support, I don't think it means that they should scrap the system. It means, but it's important for them to understand that this is one consequence of what this policy is doing, and maybe they can think of ways to design the program in ways that will reduce these types of disincentives. My own view is this is still enormously beneficial because you really need to help the vulnerable group of older people in China now. And I think the government in China, given its financial position and the number of older people and the degree of vulnerability of this older generation, I think they should be very generous to them. It's not a big deal financially for the country to be very generous to its older population. Okay, then there's another paper on the healthcare side that I've done with a former graduate student at HKUST, a master's student, MPhil student. And we were looking at the pattern of health expenditures of older people as they get older. Are they, many countries have this problem that towards the end of life, the expense of healthcare explodes. So at old ages, it becomes very expensive for the healthcare system or the country to support these healthcare costs. And so we were interested in general also, of course, there's this issue about high rates of elderly poverty. So what's going on with the expenditure levels of the older people? And we started with a very interesting initial observation that, again, separating the two worlds in China, the urban and rural worlds, if you just look at the household per capita total expenditures for people in urban areas, you see this pattern where it kind of declines from 45 to 65, but then it starts to increase, right? So it's kind of a U-shaped pattern. But for rural China, it doesn't come back up. It just goes down, 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 right, to a pretty low level. Again, we're seeing this urban-rural difference in vulnerability. And so we said, well, why is that happening? And so we can divide this total expenditure into its components. We can look at food expenditure, medical, healthcare expenditures, and other expenditures, right? And what you see is, food expenditures are declining for both. The big difference is in healthcare expenditures. Look at this line for urban people, right? It's increasing very dramatically with age. And this is what you would expect to find. People's health is getting worse. They're going to have to go to the doctor more often. Every country in the world pretty much sees this pattern of increasing health expenditures with age. But in rural China, nothing, right? If anything, after 65, it's declining. So think about that. These older people in China, they have worse health. They're spending less to go to the doctor. Okay? Even though now many of them have health insurance. So why isn't that health insurance working for them? If we go to the individual data, so in CHARLS we ask every person, how much did you spend? So that's household level. Then we go to individual level and say, how much did you spend on healthcare services in the past year? And we can do this out of pocket or also including the part that's reimbursed by government. Patterns are the same. We find, again, this huge urban-rural gap. Urban people get old, they spend a lot more money on healthcare, rural people don't. So kind of our research question was trying to explain this puzzle. What's going on here? And again, I'm not going to put all the tables and stuff. I just want to just highlight what we found. Okay. So we document for the first time, I think, that this pattern of declining health expenditures with age. And we try to look at what factors might explain that. And we found that there are a number of characteristics of older people and their families that can kind of explain some of the differences and changes in the amount of healthcare spending, whether you're economically active, whether you're living with non-adults, and whether you have good insurance. So if you have good insurance, you're much more likely to be increasing. If you have bad insurance, you're more likely to be decreasing. And most of the rural people have bad insurance. Also, this is an interesting finding, is that if you're an old person and you're living with a non-adult, meaning a child in the household, so typically a grandchild, then you're less likely to spend money as you get old. And so this suggests the idea that old people, and this I've seen from many interviews in rural China, that many old people say, I'm old, don't spend money on me, especially when the family's not rich. We have a kid who needs money for education, we have other needs, just let me kind of, don't waste money on me. I'm happy, I've had a good life. This kind of attitude, it suggests it might be very pervasive in China, right? But even when we try to throw in all these things that might explain it, we can't explain all of it. In fact, there's a huge chunk of this pattern that remains. So it could be almost cultural or norms that these older people feel like they don't want to, or of course we don't know if it's the old people or their children are saying, we're not going to spend money on you, or if it's the old people saying, please don't spend money on me. The data can't tell us insight at that level, but we know something's happening, right? And this, I think, has a lot of implications for policy. We have to understand why this is happening, because it seems like there's a lot of older people who have healthcare problems that are not getting, they're not getting treated for. And treatment, of course, is costly, but treatment will improve their health and improve the quality of their lives and the length of their lives. So I think it presents an area for further research. Okay, so that's it for the results. So this is my last kind of substantive slide. I want to just say a few words about what I think are the biggest priorities from a policy standpoint for dealing effectively with this aging problem in China. One thing is, and this is also true not just for China, but for many countries, including Hong Kong, that they have to raise mandatory retirement age in urban areas. And I think they will in time. And they need to design systems that provide neutral work incentives. What I mean by neutral work incentives is that people who are willing and capable of working should not be forced to stop working. And in the US, actually, the system where we have these defined contribution systems, it's pretty good at not disincentivizing people to continue work. In fact, the US does it much better than many European countries, but in many countries don't do it very good, including China right now, and maybe Hong Kong as well. So we need to raise retirement age at universities as well, and allow productive professors to keep working. That should be a very popular sentiment.
Yeah, among the highest retirement age in Hong Kong universities.
And the other issue is China has done a very good job extending coverage to a large share of the population, but the big challenge is the quality of coverage now. And integrating these multiple programs across regions, across program types, there's a lot of perverse incentives that occur. For instance, many migrant workers, if they work in a factory in Shenzhen or other places, by law, the employer should offer them coverage under pension and healthcare programs. But that is very costly to both the worker and the employer. In China, most of the systems require a very high payroll deduction. So the employer provides up to 30%, 40% sometimes of the wage. Worker provides 10% or so of his wage, and that goes into the program, and of course they get the benefit. But now, because many rural migrants have coverage in their home villages, they have health care insurance and a small pension program now, which doesn't require any work. I mean, it's just part of the social programs out there. Now they're even less likely to ask the employer to provide that benefit. And so oftentimes in China, the migrant worker and the employer come to an agreement that they will not ask for those benefits. And maybe they'll get a little bit of a higher wage. They'll both kind of share the saved cost to some extent. And that may be fine, that may be win-win for both the employer and the employee, but in terms of designing a comprehensive program that's well financed, it's really terrible. I mean, it's really hard to finance a system where a lot of the young people are migrants and all the old people trying to claim benefits are not migrants, and none of the non-migrants are enrolling. And so there needs to be much more thought into integrating these multiple programs. I mean, in Hong Kong too, I think there are issues in the healthcare programs as well. There's now discussion that we have this universal coverage free healthcare, and then we have a private healthcare market. But many people in China, in Hong Kong, when they hit age, when they retire, basically they can't afford the private healthcare. The insurance that private healthcare providers are willing to provide are so expensive that unless they're very, very rich, they basically shift from a very nice employer-provided scheme to the basic public scheme, and that's what takes care of them to the end of their life. And there's no middle kind of ground, even though they'd be willing to pay something in a pooled program. So this is my point, that these issues of integrating systems and thinking about how it affects especially older people is a very tricky and important policy challenge in many countries. So let me conclude. I was asked by the organizers to say something about what are the funding needs of possible projects in this area of aging. And so I came up with a few. Our CHARLS survey, the China one, it's a major effort. We are always trying to raise money, and we don't always meet our fundraising goals. Of course, there's certainly a possibility to extend this to Hong Kong as well, which would be very, I think, useful for informing aging policy in Hong Kong. We've had some discussion, my colleagues in life sciences, et cetera, about trying to establish an interdisciplinary center on aging at HKUST. And so I think there is enthusiasm for that, for people coming from different schools in the university. And there's a lot of scope for very interesting research to evaluate different possible policy interventions to support the well-being of older populations in China or in Hong Kong. And this would be not a huge national survey, but a more modest test of, let's say we have this idea, if we did this, would that help? If we, Carl Harrop said there was a nursing home that had put in like Japanese gardens in their nursing home and allowed older people especially with cognitive limitation, Alzheimer's, to spend some time every day just looking at this very peaceful thing and actually improve their cognitive function. So, whatever the idea would be, or some, dancing in the squares like it's really popular in China, can we introduce that? There's many things you could try and say, let's design a study where we really measure the impact and measure the cost, the benefit, and say, is this a good idea or not? And I think there'd be researchers very eager to collaborate with providers to design and evaluate such types of programs. So finally, let me just make a final pitch for our Institute for Emerging Market Studies, which Joseph mentioned that I now direct. It's an institute that's a couple of years old, and we have over 40 faculty associates from departments across the university, mostly in the business school and in the social science division, looking at various aspects of policy and business issues facing emerging markets, obviously with a kind of a focus on China, given our location and the expertise of our faculty, but with a real broader global vision. And we now produce policy briefs. We've provided a package of information for you at your place, which has some of the policy briefs which are designed to convey interesting, useful research results in a very accessible way. And we have a working paper series, and we organize lots of events. And so if you're interested in being on our mailing list, in the evaluation feedback form, you can just check a box and sign your email, put your email there, and we'll put you on your email list. And you can also find us at IEMS.USD.Hong Kong. We have a very well-designed website where you can even watch the past seminars and activities online if you don't have, I know, very busy people in the room, if you don't have time to attend in person. So thank you very much for your attention.